So St Helens Cares is made up of the hospital, the mental health trust, the local authority, the CCG and the voluntary sectors, and St Helens is leading the way in local place-based care in the country to provide the right quality service and the right information first time for all the citizens of St Helens.
The Shared Care Record is a really useful tool which for GPs is accessible on the same screen as your day-to-day working screen. It's also accessible to people in hospital, in the local authority, people who've got permission to access patients' care records. Moving forward, it means that we can also access the same information to make that care joined up for the patient.
One of the greatest benefits that we found is out of hours we can check the GP information before we go. We know what medication someone's on, so we're not double inputting medication, and we know that the information that we've got is accurate and will keep our patients safe.
The shared record helps us to access information that we wouldn't normally be able to see. We generally used to go off what the patient told us medication wise, whereas we can come back, we can access the contact shared record, look at the medication, clarify that, saves us contacting the GP and requesting an email be sent over to tell us what medication they're on. Also, if for any reason an assessment turns into a crisis response assessment, if somebody hasn't took the medication down, we can access it straight away.
Okay, so of an evening we receive referrals from North West Ambulance, and we need to follow these up when they come in. We need to find out where the patient is. We need to put things in place for the discharge, for a safe discharge. We used to have to phone up, chase them around the hospital, get tracking in place. Now with the Shared Care Record, that will tell us where they've been admitted, what ward, what bay, tell us all the right information much quicker.
For a long time, patients have thought that we could access the GP records from the hospital, whereas up until quite recently we haven't been able to. But with the Shared Care Record, I can go in context from our A&E patient menu and go straight through into the Shared Care Record, so I can access accurate information about their medications and their allergies and their up-to-date problem list, which when a patient comes into A&E and perhaps can't communicate very well, is really, really helpful in making good clinical decisions.
So, being based on the A&E and frailty team, a lot of our patients have quite a lot of comorbidities. Using the Shared Care Record, it allows us to get more information on these comorbidities and how it's likely to affect the patient, and that allows us to do a much more thorough assessment.
Using the Shared Care Record, it helps to prevent unnecessary assessments in a timely manner and promote continuity of care between professionals.
I've used the St Helens Shared Care Record on a weekend when a patient is either off the ward or the GP surgeries are unavailable, so it's been really good and handy when it's out of hours.
I manage the health staff within the team, and we work in collaboration with the local authority and North West Borough's NHS. The Shared Care Record has proved a massive benefit within the team and for the patients of St Helens Borough. The proactive care coordinators use it regularly to provide details to GPs and to gather information prior to risk stratification meetings.
We coordinate monthly multidisciplinary team meetings to look at patients who are at risk of hospital admission or who have several long-term health conditions. We find that having access to the Shared Care Record benefits us immensely. We can look at what current medication people are on, we can look at recent results, recent consultations they may have had with GP practice. We can also look at upcoming outpatient appointments, and we can use all that information to feed into the multidisciplinary team.
I think the main benefits are going to be stopping confusion when you're having procedures or being prescribed drugs. Now hopefully when you've got this shared record which everything is on, then that would stop all that kind of confusion.
We are going to be launching it, moving into care planning. We're again following and adopting the practice that's happened in Manchester, because they've seen huge benefits from the Shared Care Record. We're looking to do the same in St Helens in terms of avoiding unnecessary admissions. So absolutely supporting one of the key national digital aims for the NHS about ensuring that we empower our clinicians and also empower our citizens and patients.